I move Ceann Comhairle. Ceann Comhairle, the submission of this no-confidence motion was not rushed. It is not vindictive or personalised. This motion was submitted because of the scandal of the National Children's Hospital and because the overspend represents for us the final straw. There are those, Minister, in your own party and those in the media who will say that they believe this motion is unfair. When I hear that, I wonder if these people have been living under a rock for the past 3 years. Are they being deliberately obtuse, or are they just being partisan? There are those who will say this motion won't build a hospital, won't reduce a waiting list or get a patient off a trolley, but let's face it, nothing that this government is doing is currently achieving that either. We're not going to stand on the sidelines and let the government off the hook for failing to deliver repeatedly and presiding over a huge waste of taxpayers' money. We were elected to stand up and give voice to our constituents. And at least we are using our voices, unlike the men and women of Fianna Fáil, who proved themselves incapable of understanding political accountability when in government, and who are showing that they either don't understand political accountability or that they are afraid of it here today. What we in Sinn Féin seek to do is to do what is right in the service of political accountability and the future of our health service. The National Children's Hospital overspend is not an isolated incident. It is another in a series of scandals, mistakes and failures that have blighted your ministerial term. You will stand up in a few minutes and you list off what you see as your achievements, but they pale into insignificance when compared to the failures you have presided over for the past almost 3 years. You tweeted today about the repeal of the 8th Amendment and the passing of the Public Health Alcohol Bill. But these are things that you did not do alone, and to try to claim credit for the decades of hard work by pro-choice campaigners is more than a little bit sad, Minister. Even your most ardent supporter could not defend your record in good conscience. How can anyone defend record-breaking levels of patients on trolleys? How can anyone defend failed scoliosis action plans? How can anyone defend chronically understaffed child and adolescent mental health services? How can anyone defend a 27-week wait for the results of cervical smear tests? How can anyone defend record-breaking waiting lists totalling 1 million patients? How can anyone defend forcing nurses and midwives onto the streets to strike for safe staffing? How can anyone defend your role in the cervical check scandal? How can anyone defend the recruitment and retention crisis across the front line of our health service? How can anyone defend thousands of children waiting years for speech and language therapy or waiting years for occupational therapy? How can anyone defend hundreds of older people waiting months for home support services? How can anyone defend the crisis created in general practice? How can anyone defend the spending of €2 billion on agency staff in 8 years? How can anyone defend misleading the Dáil? How can anyone defend knowing of a catastrophic overrun on a capital project and doing nothing about it, saying nothing about it and actively keeping it from colleagues? How can anyone defend the withholding of and drip-feeding of information to TDs and Dáil committees? How can anyone defend reappointing a board who were presiding over the meltdown of the Children's Hospital project without seeking any advice on the performance of that board? How can anyone defend an expected cost overrun on the National Children's Hospital of €450 million? I could go on, but I only have 5 minutes, not 5 hours. The simple fact is that nobody can defend it. No one except you and the opportunistic cowards in Fianna Fáil. It is incompetence and a lack of ability which have brought us here today. Past performance is, I believe, an indicator of future performance. But your past performance makes me certain that you are not up to the job of being Minister for Health. You are out of your depth, Minister. How can we in good faith, in addition to all of the other failures and the gross level of incompetence and impotence displayed by you as Minister in your handling of the National Children's Hospital, say that we are confident that you are the person to lead the health service? We cannot and we will not. The overrun at the National Children's Hospital materialised on your watch and under your nose, but there was another person involved further back in this project whose role in this cannot be ignored. Who agreed to the doomed two-stage procurement strategy just for political expediency so that he or another Fine Gael minister could cut the ribbon? It was your predecessor in health, Taoiseach Leo Varadkar. In 2014, it was recognised in a procurement strategy report that this approach was untested in the state and that it carried significant risks. That report stated that added pressure would be put on the project's design team, which could lead to a poor quality price. All of the available evidence pointed out that we would be where we are today, and yet Mr Varadkar, the politician who governs by optics, took decisions so the ribbon could be cut early. He didn't do this for the children of the state, he did it for himself and for Fine Gael. And on your watch, you continued in exactly the same vein. Minister, if the tables were turned, and if it was I or any other opposition TD who were in your shoes who had presided over the litany of scandals that you have presided over, would you vote confidence in us? There's not a snowball's chance in hell that you would, and there's not a snowball's chance in hell that we will vote confidence in you. Hear, hear.